Hi, this is Dr. A with your medical terminology video. We're going to look at therapeutic procedures for the respiratory system. Okay, so let's talk about respiratory therapy. An aerosol therapy is a medication that is suspended in a mist and inhaled. It is delivered by a nebulizer or a metered dose inhaler. Metered dose inhaler are the puffs. The nebulizer, it looks like a little pipe that emits mist that you breathe in. Continuous positive airway pressure, also known as CPAP, is a machine that supplies a constant steady air pressure through a mask to keep the airway continuously open. So CPAP is often used at night. It's a big old mask that fits over the nose and mouth. Endotracheal intubation is a placement of a tube through the mouth and into the trachea to keep the airway open. This is when somebody's intubated, it's usually because they're going to be put on a ventilator and they need assistance in breathing. Intermittent positive pressure breathing, or IPPB, is a method for assisting patients in breathing with a machine that produces an increase in positive thoracic pressure. So it pushes some of the air in and increases the pressure inside the chest. So here's an example of what an endotracheal intubation looks like. So we go through the mouth. We got to get past the epiglottis and into the trachea to place the tube. You don't want the tube to go down in the esophagus, and then you can try to get it down here to where the beginning where the trachea divides into the bronchi. A nasal cannula is a two-pronged plastic device to deliver oxygen into the nose. It's usually on a tubing here, and it just goes right here to the nose. Postural drainage is the drainage of bronchial secretions by placing a patient in a position that uses gravity to promote drainage. It is a cystic fibrosis treatment. Supplemental oxygen therapy is providing additional oxygen concentration to improve the oxygen levels in the bloodstream. A ventilator is a machine that provides artificial ventilation for a patient that is unable to breathe alone. So it does the air in and air out for the patient. So let's look at some surgical procedures. Bronchoplasty is the surgical repair of a bronchus. Laryngectomy is the surgical removal of the larynx. So that would be, for example, if there was cancer. A laryngoplasty is the surgical repair of the larynx. Lobectomy is a surgical removal of a lung lobe. A pleurectomy is the surgical removal of the pleura. Pleurocentesis is the withdrawal of fluid from the pleural space to relieve maybe some pressure from that fluid accumulating there. Pneumonectomy is a surgical removal of an entire lung. Rhinoplasty is a surgical repair of the nose. Thoracentesis is the surgical puncture of the chest wall to remove fluid, also called thoracocentesis. A thoracostomy is an insertion of a tube, a chest tube, into the chest to drain off fluid or air or blood. So that happens if they have a pneumothorax or a hemothorax. A thoracotomy is the incision into the chest cavity. And tracheotomy is an emergency procedure to create an opening directly into the trachea. It's usually like right down here, right? And this is so the person can breathe easier, also called a tracheostomy. And so here it is. Right here, I don't know if you can see it. You find a thyroid cartilage, which is above the larynx, and then you have to puncture through here and get into the trachea. That's where the tracheostomy tube is placed. Cardiopulmonary resuscitation, or CPR, is the emergent treatment given to persons when respirations in the heart stops. And so they breathe and do chest compressions. So give him breath and chest compressions to keep him alive for as long as he can. The Heimlich maneuver is a technique for removing a foreign body that's obstructing a trachea or a pharynx, and it's done by exerting pressure on the diaphragm. It usually has to be like sudden pressure, so you put your fists together and you punch them basically in the stomach, and that blow kind of pushes air up and it can dislodge an object that's lodged into a throat. Percussion is using the fingers to tap on the surface to determine the condition beneath the surface. That can be done to figure out what's going on with the lungs. Right? Cumulative action is an action that occurs in the body when a drug is allowed to accumulate or stay in the body. So, sorry, we're into pharmacology now. Prophylaxis is the prevention of a disease. So antibiotics can be given prophylactically to prevent infection. So that would be an example of giving antibiotics maybe before surgery to prevent infection during or after surgery. An antibiotic kills bacteria like amoxicillin or ciprofloxacin, also known as Cipro. An antihistamine blocks the effect of histamine that's released during an allergy attack. Fexofenadine, loratadine, and diphenhydramine are all examples. Loratadine is Claritin, I believe, and diphenhydramine is Benadryl. Antitussive relieves the urge to cough, like Hydrocan or Vicks Formula 44, or Robitussin, antitussive, that's where they get the name. A bronchodilator relaxes bronchospasms and treats asthma, like albuterol and salmeterol. Corticosteroids reduce inflammation of the respiratory tract. They can also be given to asthma patients, like Flonase, Nasonex, and Asthmacort. Also helps to relieve congestion in the upper airway. And a decongestant, it reduces congestion in the respiratory system, like Afrin, Droxorol, and Sudafed. An expectorant improves the ability to cough up mucus, like Robitussin or Mucinex, so that it helps to thin that mucus and get it out. And a mucolytic, it liquefies mucus, so it is easier to cough up, like Mucimis, so breaks it up. So a lot of those cough medications are a combination of expectorant, mucolytic, and sometimes cough suppressants too. So that wraps up all of our therapeutic procedures for the respiratory system.